If we are compassionate to others and we're kind and caring to them, it does us a world of good. And we have to really differentiate between what's in our control and what's out of our control.
Hi everyone, my name is Madhav Raman. I am a UNSW Health and Wellbeing Ambassador and an international student studying my Masters in Public Health and Health Management. COVID-19 has really thrown our world upside down. At the beginning of this pandemic, we brought some of our UNSW Health and Wellbeing experts to discuss some of your frequently asked questions. JH, the Senior Counselor at CAPS, shared some great advice about looking after our mental health and caring for the community, which I really wanted to highlight. The first question we asked JH was about maintaining our mental health and well-being when we're away from family and friends during these periods of social distancing and self-isolation. I know I'm always worried about my family and what would happen if they got sick. This is what JH had to say about caring for our mental health during this period.
I think it can be a very challenging time to suddenly move into complete isolation and cut yourself off, so to speak. But I think we have to think about that time as can we structure it a little bit? Can we make things that we do, that there's things that we do that we enjoy in that time, things that we do if you're not feeling unwell but you're isolating, that you still do enjoyable activity, that you still reach out to people even if it's online, that you try to practice good sleeping, good eating, try to do a bit of moderate exercise even if it's indoors or with avoiding other people doing that. But I think it's a high risk to just try to do nothing, because your mind will run away with you and anxiety will rear its head and it will be quite hard to stay on top of it. So I think it's important to think how you want to structure your day. Do you want to do a bit of studying? Do you want to do a bit of reading? Do you want to look at things you've never had time to do? Maybe you want to explore art. Maybe you want to explore something that you always had an interest in, but you've never really had any time. But now you have time, so you can do those. But I would also encourage people to keep as much contact with others and to figure out who else might be around that was in the same boat, and they can have different contacts. Because I think the thing we underestimate at times of this is if we are compassionate to others and we're kind and caring to them, it does us a world of good, because it's something that people are expecting to do to you because you're isolating. But if you also reach out to others, that can really brighten up your day. You can have systematic contact with people at different spots, try to meet people online, try to be quite productive in doing things you've never done. Maybe read that book you've always wanted to read. Maybe practice a bit of mindfulness. There's a host of apps and things people can use. And just try to think about how to live life where that 2 weeks can be as meaningful as possible without being too concerned. The thing that people dislike the most is that social media can be quite bad for us quite quickly. And I think if you are in a period of isolation, maybe figure out what is a very reliable resource. Tap into that once a day, but try to stay clear of it for quite a bit of the day, because it becomes a bit of a self-defeatist activity to keep checking, because there's always someone putting something out there. It might not always be reliable, it might not always be factual, and there's a lot of scaremongering going on. So I think it's important to pace ourselves, to have a structure to your day, to know when you're going to do what. If you can get out for a little bit of moderate exercise, even if you're doing it by yourself, do it. Don't not exercise. Try to keep eating. Try to keep sleeping. Try to keep doing things, and be compassionate to others. Reach out. Be that person you always wanted to be. Be the one that cares for others, and they will care for you. And I think that changes how you feel about being self-isolated, that it's not a form of punishment, but it is something you're doing for your community. You're actually putting a safeguard in to look after people, because we know vast majority of people that self-isolate will be well, and they just need to go through this period of time to make sure that we can curb the infection.
JH, something interesting that popped up when you answered that question was sleeping habits. What if a student is really getting anxious and can't sleep because there seems to be a lot of panic around getting sick and dying? So what strategies would you suggest to cope with this, apart from the already whatever you mentioned?
Yeah, I think people will find it surprising, but I think when you go into sleep, you can't chase sleep down. You can't beat sleep into submission. It almost have to come to you a little bit. So to get that anxiety down right at the start, what we often suggest to people is to do simple breathing exercises where you breathe in for 5, you hold it for 2, and you breathe in for longer than you breathe in. So you breathe out for 7. And you just keep doing that for 2 minutes. And what that will do is it will flip your system into a motion where you can actually feel more at ease, because the panic will drive you to have a systemic heart rate to be quite jittery, and it will be impossible to sleep. So try to count in 5, hold 2, count out 7. Do that for 2 minutes, and then you follow your normal sleeping pattern. Obviously, blue screens aren't great for sleep, so you can't just be doing device and think you're going to fall asleep. You have to lean into sleep. You have to have your pattern and try to stick to it as much as you can, because that last little article you're going to read is probably going to keep you awake, not make you sleep. So sleeping can be quite tricksy, but if you follow that breathing exercise, there's lots of apps, Sleeping Minds, Smiling Mind, Smile. There's lots of free apps people can download. They can listen to maybe 10 minutes before they go to sleep, just to drop away, get your breathing down, have a calm state to go into sleep. Because sleep is our friend even when we're unwell. That's how we recover the most. Is people feel drowsy when they have the flu or they have bugs, and we should try to embrace it. But social media, unfortunately, often chases sleep away, because there's just one more thing we want to read. There might just be one more thing that come up. And we have to really differentiate between what's in our control and what's out of our control. Stuff that's out of our control, we have to spend as little energy as we can on. Things that's within our control, cleaning our hands, wearing a mask, going for a bit of exercise, eating the right food. We should encourage those things. But the things that we don't have any control over, we should try to step a little bit back and just let the anxiety pass by doing those breathing exercises.
JH has shared some really useful techniques and tips to keep our mental health and well-being in check. And one area he highlighted, which is really important, is around sleep. I know I'm always tempted to read one last social media post or news story before I go to bed, and that does affect the way I sleep. I don't wake up energized or rejuvenated if I don't get enough sleep. Simple techniques like doing basic breathing exercises or using apps such as Smiling Mind will definitely help in the way I sleep here on. I would like to share a beautiful line written in Charles Glassman's book called Brain Drain, the breakthrough that will change your life. And it states, kindness begins with the understanding that we all struggle. And out of that struggle we all face during this pandemic, we need to be more compassionate to our friends, family, neighbors, and community at large. So we shouldn't feel ashamed to reach out for help from our loved ones, or our friends, or our family. It's okay not to be okay. UNSW CAPS is offering telehealth as well as face-to-face consults. So please call them if you do need to talk to someone. Be safe, be healthy, and be well.